over 75 will be allowed to get COVID-19 vaccines next week in North Carolina, but local officials are stressing that supplies will be limited. Nationally, it's been off to a slower start than expected, as the U.S. will not meet the goal of vaccinating 20 million people by today. Our Capitol reporter Michael Hyland live in Raleigh getting answers about the initial rollout and what to expect next. Michael.
Right, workers at hospitals are getting the vaccine now, but next we'll be moving to people who are 75 and older. But with those limited supplies, it's not clear how soon those people will actually get those shots. Changes in North Carolina's COVID-19 vaccine distribution plan mean some people will get it sooner. Phase 1B begins next week with anyone 75 and older eligible to get the vaccine, but they may not get it right away. Counties are adjusting their plans to account for the latest changes in the prioritization list. Mecklenburg County leaders said Thursday they support the move to vaccinate people over 75 next, but they're telling people supplies are limited and appointments will be made based on what supplies are available. In Wake County, officials say first they need to get through everyone in 1A, which includes people at hospitals. That process is still underway, meaning they may not be able to start on Group 1B next week.
Maybe we'll undercommit and overdeliver, I think, here in the county, but I think the real reality is the total number of doses that have come into the county, don't really cover the 1A criteria as maybe as we had hoped.
As of Thursday, the CDC says about 328,000 doses of the vaccine have been delivered to North Carolina. 73,000 people have actually gotten their first dose, meaning about 22% of those doses have been administered. State health officials addressed the speed of the rollout this week.
Some of our local health departments did not receive their first round of delivery until last Wednesday, the day before Christmas Eve. So we know that we are ramping up over the course of this week.
Dr. Mandy Cohen said she expects the pace to pick up after the holidays, but the next round also brings more logistical challenges.
It's new for all of us, so we want to make sure that we are tracking appropriately because, as the governor mentioned, not only are you needing to get that first dose, but you have to come back to get the second one. Brian Jury with Wake County said at this point he can't give an estimate of when the county will be able to move into Phase 1B. He compared this process to trying to build the plane while you're flying it. Live in Raleigh, Michael Hyland, CBS 17 News.